Hello, everyone. My name is Tina Cosby. I'm with the Indianapolis stations of Radio 1. I do a talk show, Community Connection, on AM 1310, 92.7 FM, and 95.1 FM, The Light. Today, we are happy to be speaking with Eskenazi Health, the sponsors of a number of seminars and informational sessions on a number of things that you need to know about. And right now, we're going to be discussing the flu and COVID situation for this particular season. And our special guest from Eskenazi is Dr. Amy Beth Kressel. Dr. Kressel, welcome back. So happy to have you with us. So happy to see you again. It's been a while since we last spoke.
It has been, and thank you for the opportunity.
Yeah, so Dr. Kressel, I know who you are, but can you introduce yourself and let everyone know what you do who may be watching?
Yes, so I'm an infectious diseases physician. I specialize in treating infections in adults. I also am the director of infection prevention and the medical director of antimicrobial stewardship at Eskenazi Health. So in those roles, I help optimize antibiotic treatments for patients and try to prevent people from getting sick while they're in the hospital.
Yeah. Antimicrobial stewardship. And so,
So basically helping other physicians pick the right antibiotics for patients.
uh-huh.
And we have the mantra, right drug, right dose, right duration, right bug. So basically don't use antibiotics when they're not needed. And when you do need those antibiotics, dosing them correctly and for the right period of time.
Yeah, and I want to circle back to that, but first, doctor, what is what's the status? We're early December, very early December. So where are we as far as COVID and flu?
So COVID cases have been increasing, at least in terms of our hospital numbers. It is not the same kind of surge that we had last year with Delta and Omicron, but we have seen an uptick in the numbers of our patients admitted with COVID-19. We've seen an uptick in the percent tests positive. So that's kind of a measure we look at to try to get a sense of what's going on. We can't really look at total number of positive tests as much anymore because so many people are getting tests at home. So it makes it really hard to do comparisons with the past. But if we look at people who do come to our laboratories to get tested, and we look at the percentage of those who have positive COVID tests, we've seen an uptick in that. We've also seen an uptick in our own employees who are calling in sick. So by all those measures, it seems like there's more COVID going around. In terms of the US, in terms of deaths, the United States is seeing approximately 300 people a day die of COVID. And those numbers have held pretty steady for a while now. It'll be interesting to see what happens in the next 2 weeks to see if the increased cases translate into increased deaths. As far as influenza, we are seeing a lot of influenza. So if you look back in the past 10 years, this has been the busiest and highest number of influenza cases we've seen this time of the year in the past 10 years. So if you look at December 1st and you look back 10 years in the past, we have more flu cases now than on any December 1st in the past 10 years. And those cases are rapidly increasing. And we're seeing it also in people coming into the hospital. The influenza vaccine that we currently have in the US does seem to be a good match for what's out there and circulating. So I urge people to consider getting a flu vaccine and a COVID booster if you have not. It's a little frustrating to me as a physician because we actually have countermeasures for these things. So for COVID, I see you nodding. We've had this discussion before. We have vaccines. So if you've already gotten vaccinated, congratulations. If you are now able to get a booster, please get that booster. There's a bivalent booster out for COVID. And basically, it takes the original COVID vaccine and then it adds a second vaccine against one of the Omicron variants. So that booster, by letting your immune system see the old original one and then this new Omicron variant, it will cause you to have a broader antibody response. So it kind of your immune system, instead of seeing one kind of COVID, will see two, and it kind of broadens out the immune response that can result. Omicron, it keeps shifting. So the Omicron variant that's in the booster is not exactly the same as what's circulating now, but you still will literally get a boost in your immune response. And and while you may still get a mild case of COVID, you should be very well protected against severe COVID.
Yeah.
I know we've had this conversation before, but it bears repeating. If you have never gotten a COVID vaccine, you can start now. You will still get an antibody response. And again, I think the name of the game is trying not to get in the hospital. You might get COVID, but hopefully not land in the hospital and not die if you get these vaccines. And then influenza vaccine, it's a very similar story. We've had influenza vaccine for a very long time. We know that it does not prevent every single case of influenza, but we also know it prevents the most severe cases. So there have been studies done over the years looking at this, and the influenza vaccine gives you approximately 80 to 90% protection if you look at the most severe illnesses. So if you're looking at people who end up in the hospital or end up in ICUs or end up dying from influenza, that's where you get that 80 to 90% protection. There was just a study that came out, a very large study looking at giving influenza vaccine for pregnant women. And we've known this for years. We've known that giving influenza vaccine helps prevent miscarriages that can be caused by influenza. We know influenza itself can cause miscarriages, and the vaccine can prevent it. And there was just another study that came out, a very large study, that reaffirmed that pregnant women really do benefit from getting the influenza vaccine. It protects their pregnancies and it protects their unborn children.
Dr. Kressel, is COVID protection available for children under the age of 5 now?
Yes, children 6 months and older can get the COVID vaccine now. And children 5 years and older, basically anybody 5 years and older, can also get the booster.
Wonderful. Okay. And parents will probably be happy to, but parents have been so used to it being kind of an adultish type of thing that I think it's going to take parents a while to kind of warm up to the idea that, but as my daughter said, my grandson, he gets the flu shot. He's been getting the flu shot since he was 6 months old, and he'll probably get the COVID shot. But again, that's just something for parents to know, more information for them to know, and more information to study so that they can be, made aware. And now you say the influenza, the cases of the influenza are rare in terms of numbers for this late or this early. I mean, we're not even officially winter yet. Do we happen to know why that is, or it's just one of those things that is right now?
If I knew influenza, if anybody knew exactly how to predict influenza, we'd be making a fortune in predictions. Uh, all respiratory illnesses except COVID decreased when we had the worst COVID surges. And that was probably a combination of some competition between the viruses that we do not fully understand, because we saw the same thing with H1N1 in 2009. When H1N1 influenza hit in 2009 and 2010, all the other respiratory viruses went on hiatus in the United States, and we did not have social distancing. And then COVID hit in 2020, and it really, all the other viruses kind of went away. And we do think that we did have social distancing then. So we think a lot of that was people having fewer interactions, international travel shutting down, and those things probably played a role, but there might have been some viral interference as well. Now we're in a kind of odd steady state where there hasn't been a surge in the United States in COVID for several months now, but there hasn't been a decrease in cases either. I don't know where COVID's going to end up, if this is going to be a permanent steady state or not. But right now, COVID cases have been very steady, and not in a good way. 300 people in the United States are dying every day.
Mhm.
That's not a happy, steady state, but it is a steady state. And people are traveling.
Mhm.
Travel numbers have surged. The travel industry is roaring back.
Yeah.
People are not wearing masks anymore. So all these things are happening at the same time. So probably in retrospect, this is why influenza is coming back. Why did influenza not come back last year? I don't know why. Maybe there was too much COVID around, or maybe the travel had not returned already, right? Even though travel was starting to pick up last year, um, we are seeing more travel this year. But it's really easy to look backwards and say, oh yeah, this is why influenza is doing this. Um,
So, when people hear on TV or read in the paper physicians talking about the triple threat for the winter months, what are they? Can you translate for us, please?
yes. So we already talked about COVID and influenza. The third triple threat is respiratory syncytial virus, which is RSV. So this is something that has also not been behaving properly because of COVID. So RSV went on hiatus when COVID first hit in 2020, and then it came back in the summer. And RSV has always been a winter virus. It came back in the summer, kind of went away again, and then came back again in the summer. So RSV is something that it's more severe for people at the extremes of age, as we like to say. So infants and the elderly, and and people with damaged lungs and immunocompromise. But the greatest number of cases is in those young infants, and specifically infants who are born premature, who are even younger than 6 months, maybe 2 months, or have congenital heart disease or a lung issue. There are countermeasures for RSV, but unfortunately, we do not yet have a vaccine. So, the very highest risk infants can get a monoclonal antibody to try to prevent the illness. Um, there's no vaccine yet, but there are some really interesting vaccines that are being studied right now. And the vaccine companies have taken multiple approaches to vaccines. So, I am hoping that if we have this conversation next year, we're going to have a variety of vaccines that maybe use mRNA, vaccines that use other technologies for people who don't like mRNA, maybe vaccines for the infants, maybe vaccines for pregnant women so they can pass antibodies on to their children for those first 6 months, and maybe even some vaccines for the elderly who are also at risk. But right now, unfortunately, we don't have vaccines. So the countermeasures really for RSV are probably selective mask wearing. And I think we're forgetting we could still wear masks. And I'll tell you, Tina, a few months ago, I finally decided not to wear a mask anymore in public. And having said that, though, I have selectively gone back to wearing a mask. So in my particular situation, I don't have a high risk person in my household. But when I was planning to travel for Thanksgiving, about 1 or 2 weeks before that travel, we all started wearing masks again because we just didn't want to have to cancel our plans. And we were going to visit older people when we were traveling. And I think people can think about this. If you are at risk, right now you have RSV going around, and maybe you are older, or maybe you have a lung or heart condition that puts you at risk for RSV, you could put your mask back on. And if there's someone in your household that's at risk, you can put your mask back on. I think, again, just because we don't have to wear masks anymore, it doesn't mean we can't wear masks anymore.
So, is that your recommendation? I mean, what going forward? What should we be doing? And I'm more inclined now to put that mask back on because I was a little hesitant to take it off as well. But and I almost felt naked, after so many, so long of going with. And now I'm putting it back on. But so what's your best advice going forward, Dr. Kressel?
I wish I had one size fits all advice. Unfortunately, I really think people have to look at their own situation and decide the right thing to do. So for some people like me, it's going to be very fluid. It's going to be very dynamic. I'm going to be looking at what's going on in the community and what my own plans are going to be. And in specific situations. So in a very crowded situation, I will be more likely to put my mask on. If I have upcoming travel, I will put my mask on. If I know I'm going to be seeing patients, if it's going to be my turn to be in the hospital taking care of patients, I will put that mask on before it's my turn so I don't bring anything to the hospital. For other people, maybe you need to be wearing a mask anytime you're in public. Right now, with RSV, influenza, and COVID all circulating, if you are at risk of severe illness or if someone in your household is, put your mask back on. That would be my advice.
Yeah, put it back on. And so for people who have questions about what to do, is one of the questions I always hear. Well, it's the late. It's we're going into winter now, so it's not going to do any good to get a flu shot. I should have got it back a while ago, or what have you. Can you give? Yeah, I've got both. I've got all mine. Can you give some guidance on that, please, before we have to let you go?
We are not at any way at the tail end of influenza, so get that vaccine. And Tina, can I mention too, I know we're going to be at our end of our time. There are other things we can do. For both COVID and influenza, we have antivirals. So if you are sick with either COVID or influenza, you should speak to your physician about getting those antivirals. For COVID, we have Paxlovid, and there is regulatory flexibility. So you could, even if you don't have it might be hard if you don't have a regular physician. Pharmacists are allowed to dispense Paxlovid without a prescription, but there are some guardrails around that.
Oh, they are? I
They
didn't know that.
are. Yes. Now,
Wow.
not all pharmacies will do that. Pharmacies are not mandated to do it, but a lot of them
I
have
didn't know that.
adopted. Yeah, no, a lot of them have adopted that flexibility.
Wow.
There are some guardrails, so you probably have to present some lab work
I
if you
see.
don't have a physician prescription. But
Yeah.
you might be able to go to the pharmacy and just get Paxlovid, even if you don't have a doctor's prescription. Again, there are some guardrails around that. But you can also call your physician and get that prescription and go to a
Uh-huh.
pharmacy and get Paxlovid. And there are no
Now,
situations.
excuse me, when is Paxlovid most effective? Early COVID, middle? I mean,
First 5 days.
huh?
It's in the first 5 days of symptoms.
First 5 days. First 5 days of symptoms or first 5 days of testing positive?
Whichever is first. So your first symptom, if that happened first, or your first positive day.
Wow. Wow. And the guidance or the guidelines now for how long you should isolate or be away from people. I mean, it's certainly dwindled down from 2 weeks. The original was
Right.
2 weeks.
Right. They're saying if you have a negative test or those first or at least 5 days. So, yes. And that's hard to track also. They keep changing it.
Yeah. I would imagine it's hard to track with so much home testing as well. Hard to
Yeah.
track where we are.
Right. And that's why I like to look at the percent positivity at my own hospital, which
Ah,
gives me a very local view of what's going on. But we also, to some extent, will look at things like people calling in sick or the number of people in the hospital. The other measure is there are other measures the government looks at. So they look at lab tests positive for influenza, if we're talking about influenza. You can also look at a measure called influenza-like illness in emergency rooms. That has also been increasing. That will capture a lot of things. It captures influenza and other things that present in a similar way. For influenza as well, there's Tamiflu. There's oseltamivir that's available, and that's a treatment available. So again, people can think about these things. It's not like there's nothing we can do for COVID and influenza. We have vaccines and antivirals for all three. For RSV, COVID, and influenza, people can think about strategically wearing masks again.
yeah. I'm thinking the mask thing. I just it's probably one of the easiest things to get back to. So your Dr. Kressel, what if people want to know more? A website or best informational source you can share with us? That would be great. What do you have?
I still go to the CDC
Uh-huh.
CDC has FluView, which gives you maps of influenza activity. Some of it is very technical, but there is information for the public and information about antivirals.
Mhm.
Um, and then they also have their COVID information, their patient-facing COVID information. So Eskenazi, we have all the vaccines available in our pharmacies. You do not need an appointment or a doctor's note, but you should check each pharmacy for hours. Sometimes the individual pharmacies might have limitations about when they give the vaccine because of staffing. So it's always good to call ahead before you go to an Eskenazi pharmacy. I would love it if everybody came to Eskenazi, but other pharmacies in town also have vaccines.
Absolutely.
So that's, and then of course the antivirals, we have antivirals for Paxlovid. Sometimes pharmacists can give it without a physician prescription, but certainly with a prescription you can get it. And we also have Tamiflu available.
Yeah. Wow. A lot to remember there, but the main thing is, as you said, get your vaccines.
Yes.
Take your antivirals.
Yes.
And if in doubt, go to eskenazihealth.edu or the CDC.
Easy.
A lot to remember, but really, the fact that so many of you are warning about, or at least alerting, making us alert about the triple threat heading into the winter months. We should all be mindful to take as much care as we possibly can.
Agreed. And I still, even though I'm not wearing it now, my mask is close at hand.
Close by. And
Yes.
the best kind, the N95s are still the best?
Yes,
Yeah.
the N95s are still the best, and we don't have the supply issues we did previously. It's always good to make sure you're getting a real N95 and not a counterfeit.
Yeah.
So you can go to the company's website. So for example, if you go to 3M's website, they'll tell you where to get a genuine one. You
Oh,
can see
okay.
where to buy them. And then Kimberly Clark has N95. So those are good places to look to see to make sure that you're getting it from a retailer that has genuine masks. They'll give you an idea of what websites to look for. The other thing is, this is actually not an N95. This is just a surgical mask, but fit really matters. So if you are wearing an N95 or surgical mask that isn't fitting right, if there are lots of gaps, it's not going to work for you. So I'm going to do a demo. So this is fitting okay. I'm not getting air leakage, but I can also play with the fit. I could pull it back tighter. I can get a hair clip to do this. And then I'm not getting any leakage at all on the sides if I do this. So the CDC actually has information about how you can kind of make your mask feel better. If you still have a cloth mask, you can wear a surgical mask and then wear a cloth mask over it. And the cloth mask actually helps it fit better. So fit is really important.
Yeah, I've seen people double the loop behind their ear, double the loop to get a tighter fit. And I have
Yes.
to tell you, when very, very, very early, I know we got to go, but got to tell you this one. Very early on, I think I had them upside down because the wire that it was down here, and I kept wondering why it kept sliding down, and I didn't realize. Again, this was early on, y'all, so I was, I had to learn. But that wire, that adjustable wire that you can put across the bridge of your nose, is really helpful. And I too have found that the basic surgical ones are because some of the KN95s are a little uncomfortable because of the fit. I don't know what you call it. But
Yes.
anyway, the ones that just come all the way up, and I'm really happy with those because there's no leakage or anything. So and they're a little less expensive too, but they all work well.
Yes.
But the mask, yeah, let's get friendly with the mask again, and hopefully we can all make it through this winter season. Final question: at what point in the calendar do we consider it to be the end of the flu season?
Calendar doesn't help us. It's all about the numbers.
Ah,
Every year flu season ends differently. So we usually talk about like the end of March. But last year, flu would not go away. It was not as busy as it is this year, but it just wouldn't go away.
Wow.
So I think it ended sometime in April.
Okay.
So
All righty.
we have no control.
Well, we do have control over what we can control, and you have done an excellent job of explaining that, including the demonstration. That was a bonus. We didn't know we were going to get that, so we like the demonstration. Dr. Amy Beth Kressel, thank you so very much. Hopefully, we'll be talking again soon, and let's hope that everybody gets those vaccines in a hurry and fast. In a hurry and fast.
Thanks.
Thank you.